Now we're going to move into the antiretroviral drug portion of this. Antiretrovirals are used to treat AIDS and HIV and are classified into 5 categories, or at least into the categories of the nucleoside and nucleotide analogs, non-nucleoside analogs, protease inhibitors, and entry inhibitors. They all interfere with the replication of the virus, but do so in different ways and at different stages of the virus life cycle. Antiretrovirals are used in combination, usually 3 drugs, as a combination of 3 drugs to control the HIV infection. Giving only one drug alone is contraindicated. And adherence to medication is key. If any missed doses may allow for HIV viruses to mutate and become drug resistant. And so nurses should take great care to avoid any missed doses. Nucleoside analogs are similar enough to nucleotide analogs that I'm just going to combine the two. They inhibit replication of HIV virus by inhibiting the transcription of RNA and DNA. And as you can see, there's quite a number of drugs in this category, including Videx, Retrovir, Hyvid, and so forth. All these drugs are given orally, but it should also be noted that Retrovir, also known as zidovudine, this can also be given intravenously. I'll also note that Retrovir is used in persons who have been exposed to HIV as well as those who have AIDS. Adverse effects. You're going to want to watch for bone marrow suppression resulting in anemia and a granulocytosis and bleeding. This is especially seen with patients on Retrovir. Epigen may be given to raise the red blood cell count. Transfusions may be needed during therapy, and make sure to teach patients to avoid exposure to infections and to have their blood counts assessed every 2 weeks. Common CNS side effects include headache, malaise, and neuropathy. Common GI side effects include nausea, anorexia, pancreatitis, and lactic acidosis. Also, you're going to want to have liver function tests done regularly. Rash and itching can occur. And also note that these drugs should be used cautiously with other drugs because there are many drug incompatibilities. As for teaching patients and family, remember to remind them that these drugs do not cure AIDS; they will just control the symptoms, and that the patient should call the physician if signs of other infections occur, such as sore throat or swollen lymph nodes, and to remind the patient they are still infected with the HIV virus, and so prevention of transmission of the AIDS virus should still occur. So universal precautions, safer sex practices, and a reminder to follow-up visits are important to monitor for toxicity of the drugs. Non-nucleoside analogs attach themselves to reverse transcriptase and prevent the enzyme from converting from RNA to DNA. In turn, HIV's genetic material cannot be incorporated into the healthy genetic material of the human cell, and thus it prevents the cell from producing new virus. Examples of the drugs include delvirodine and nevirapine. Adverse effects, you're going to want to monitor liver enzymes. Also, nevirapine decreases effectiveness of oral contraceptives and should always be given with at least one other antiviral because resistance develops very quickly when given alone. Also, severe rash can develop, so watch for that. The next in the antiretrovirus group are the protease inhibitors. These block protease. Blocking protease interferes with the final stages of HIV reproduction or replication, thus causing it to make copies of itself that cannot infect new cells. So that's how that works. As you can see, there are a number of drugs in this category: Norvir, Calatrel, Lexiva, and so forth. You can see the list. They're all given orally. Use these drugs cautiously with other drugs. Norvir may decrease effects of oral contraceptives and theophylline, and may increase the effects of antidepressants. All protease inhibitors may increase levels of several drugs, so be very careful. Look up drugs if you're not sure. Take all these with food, with the exception of Indivir, without ritonavir. Ritonavir is often used with other protease inhibitors to increase their blood levels, and common side effects include nausea, hyperlipidemia, hyperglycemia, and fat maldistribution. The final category in the antiretroviral drugs are the entry inhibitors. These work by preventing HIV from entering healthy T cells in the body. There are two drugs essentially, the Fuazon, but then there's the Celsentry and Celentry. They're kind of the same drug, just different companies have made them, as you can see. Adverse effects include allergic reaction, rash, hives, shortness of breath, fever, nausea, vomiting, constipation, and neuralgia. So you make sure to check and keep an eye out for all of those.